Hello, I'm Shelly Deutmeyer with Physical Therapy Solutions here at our Dyersville office. And as a physical therapy assistant, I often get asked a question, what really is the difference between a PT and a PTA? So there's three main areas that I'd like to cover that kind of encompass the differences between the two. So first of course would be amount of education. So as a PT, you will go to school for your undergraduate degree and then apply for PT school, which is an additional 3 years of schooling, of which you're going to graduate with your doctorate in physical therapy for a total of 7 years of education. For the PT assistant, what's required is an associate's science degree from a 2-year community college, of which there's only certain schools that have a specific program for a PT assistant. So, for example, in the state of Iowa, there's schools such as Kirkwood, Hawkeye in Cedar Falls, Waterloo. There's Indian Hills, just to name a few, but not every community college will have that. So education is the first area. And then kind of along with that, of course, with a little bit more education, a little bit more roles that are required, obviously the PTs are going to make a little bit higher salary than what the PT assistant would have with a 2-year degree. And then the main area where the difference too is in the actual treatment of what they can do with the patients. So when you first come to therapy, you'll be seen by the physical therapist. The physical therapist will have to see you on that very first treatment. And then that way they can assess what's going on, set a diagnosis, and then they set what's called a plan of care. And that's really allows us as a PT assistant to come in and follow that plan of care. So there's only certain things we can or cannot do with that patient. So they see them on the first visit, and then they are also the only patients or the only therapist that can formally discharge a patient as well. So actual treatments, then that's where the PT assistant can come in and perform whatever treatment that the therapist has set. So from doing different modalities to exercises to range of motion, they have specific training on how to do all of those and progress the patient to get them back to where they need to be. And then finally, the last thing is in the area of continuing education. Since we both, as a PT and a PTA, we hold our license through the state of Iowa, we have to get so many continuing education hours to maintain that license. So as a PT, since they're required a little bit more education and a little bit more responsibilities that they have in the clinic, they will have to attain 40 hours of continuing education every 2 years, whereas the PT assistant has to get 20 hours of continuing education every 2 years to keep that license. So those are the few big areas on education, what they can do in treatments, and their pay scale. So if you have any questions or concerns or maybe interests about either of the two that you're thinking about going in the field, we're always happy to answer those questions. You can give us a call here at our Dyersville office or at our Manchester office, or even log on to the website and find more information there.